Okay, well, I just wanted to go ahead and introduce myself. My name is Tracy Bryce. I work here at Mind Plus Neurology. I am the director of marketing, and I also organize all of the member enrichment programming, like this one we're here today. And what we're presentation for the wellness workshop, what we are going to be talking about is balance, and we're celebrating Balance Awareness Week. So this week, starting the 17th, actually, was the beginning of the celebration. The Vestibular Disorders Association, also known as VeDA, VeDA, pioneered Balance Awareness Week back in 1997. Goal was to shine a light on the invisible balance disorders, to raise awareness and better understand vestibular disorders, to become more empathetic and supportive to those that suffer from balance disorders. One thing that I was doing some research, and one thing I stumbled across was that 40% of people that have migraine also have experienced a vestibular disorder, which is a pretty big number. I thought it felt like that was quite a bit. So
do you mean like vertigo? Is
Yep,
that a
for
vestibular disorder?
Yeah. That would be
Yep,
considered.
that is definitely in the umbrella.
That I have.
Yeah, raise your hand, Paul of God. So yes, I mean, absolutely, it does. It affects people in everyday life, but it also affects those with migraine, and that's who we're primarily here to support is people that have vestibular disorders related to migraine, and certainly a lot of people do suffer from it. So you can learn more on their website by going to vestibular.org/BAW. They have a lot of suggestions on different ways you can get involved with this week. A lot of them have to do with social media, like posting, hashtag, and then also writing to your story of like how you've been affected by balance disorders throughout your life, and how you've overcome them or are dealing to manage with them on your day-to-day life. And that also, whatever there's a lot of other suggestions. So if you want to stop by their website and take a look. All right, so now I'm going to pull up the presentation and hand the mic, if you will, over to Kari Hart, our resident expert on this topic. She is an occupational therapist, and she's also certified in vestibular rehabilitation and concussion. So she is for sure the one to go to with balance disorder issues. So I'm going to flip over to the presentation.
There you go.
And,
hey. Okay.
All right, pass
Cool.
the mic.
All right. Hi, guys.
Hello.
So, as you know, I am Kari Hart. I'm the OT here on staff with Mind Plus. So if you ever need to be referred out for any balance or vestibular disorders, you'll be seeing me. And that's kind of what I concentrate a lot on here at Mind Plus. But I also can help with all kinds of other migraine related things, cervically, spinal things, TMJ. I'm kind of getting into that space a little bit too. So, not just a one size fits all for migraine. And I know you ladies, or you guys all know that that's true, right? So I'm here today too because we are, as Tracy said, along with VeDA, doing Vestibular Disorders Balance Week. She already gave you the site. It's a great reference for anything vestibular, anything balance. There's, all kinds of disorders you can look at, helpful hints, and it's all free. All the articles on it are free. It's a great website to go to if you have any questions on anything, which I pulled from there to look at balance and vestibular a little closer. I kind of outlined some more common inner ear vestibular disorders that we can see here in the clinic. So those with vestibular disorders suffer from this non-resolved dizziness. So dizziness that just doesn't go away. Motion intolerance, feeling like if you're ever had a feeling where you're driving in the car and the car stops, but you feel like your body's still moving. That's part of it too. Imbalance problems obviously go along with this, which is why we're here, because if you're dizzy, you're not going to be in balance. So a lot of these disorders I won't go through every single one, but some of these you might be a little bit familiar with. Damage due to head injury, Meniere's disease. And these are only disorders, vestibular migraine, triple PD. You guys might have heard of that. It's more in your wheelhouse. But these are just inner ear disorders too. This doesn't even go into those of balance disorders with multiple sclerosis, Parkinson's disease. There's so much that goes into the umbrella of being imbalanced that we see here. But so I just wanted to outline that there's a lot. Okay, so
I had never heard of. Sorry.
What's that? I'm sorry. Go ahead.
I know. I'd never heard of the persistent, the PPPD.
Yeah.
And with my migraines, that's when I don't think I have vertigo separate. That's all from my migraines and dizziness. That was a common one in the last few years.
Yeah, 3PD is like, kind of what we classify under these categories as like these understudied invisible illnesses that we're always learning a lot about and how we can help people with that have symptoms, because it can be so debilitating along with your migraines, and then you just don't know what's happening, either the pain or the dizzy, and you don't know which to go through first. So yeah. So to keep going, sorry to cut you off a little bit, but so to look into, I wanted to kind of go over why we stay balanced. Sometimes it's, if you have a balance disorder, it's really helpful to know, like, okay, why is this? How does my body do this in the first place? So I like to go over equilibrium. That is a large word that really just means two opposing forces working together to create balance. And your brain really likes to be in balance. It wants to find equilibrium. So it uses multiple avenues to get there, to create it. And when those avenues are damaged or there's a problem with them, then your brain is kind of a little confused. And that's where you get imbalanced. So your brain uses the visual system, of course, what you're seeing, the outside world. You're going to see what's in front of you. It's going to give information back to your brain, and then your brain's going to do what it wants with it. So your somatosensory system, so your feet to the ground, how you feel grounded, the receptors in your feet, your ankles, how you kind of perceive where you are in the space that you are. And there's so much in somatosensory that helps you do this. And we'll kind of go into these a little bit more in depth. Your vestibular system, which is a large part of the system, and the central nervous system. So central nervous system being your brain and your spinal cord. And that's that system that kind of takes all this information from the other parts of the sensory system and then produces a motor response for you. So we're going to start with the vestibular system. And here's our little inner semicircular canals here. This picture I really like because it has, whether you know anything about the inner ear or not, the semicircular canals are really important. So, and then your utricle there, right next to those semicircular canals, those house what's called the crystal carbonate. So it says that cristae within the ampullae. It's kind of just telling you that you have, I don't know if you guys have heard about BPPV. So that is where those crystals can come dislodged and go into these semicircular canals and create that spinning sensation. Have you had that before? Have you been treated with?
Yeah, I actually had to have someone go in and treat it. Once it was pretty, like I just roll over in bed. I feel like the best roller coaster ever,
Yep.
And she, got those crystals back into place, and then I had a follow up because I could just feel it starting to happen.
Yep, good. And well, not good that you had
Yeah,
it.
I know what you mean.
Good that it was easily resolved for you, and that is probably the funnest part of being a vestibular therapist is there's something occurring that we can just fix right away for you, and people are like, whoa. So that is one of the fun things to do. We just love to flip you around the mat.
Yep.
So quick overview here in the vestibular system. It tells you where your head is in space, the speed, the acceleration in which your head is moving. So not only where your head is, right or left, but how fast it's moving. It contributes to more than half of up to 3/4 of all that information to keep your equilibrium of what we talked about before and sending back to your brain. So it's a really, even though it's so tiny in the back of your ear, it really has a great contributor to keeping your balance. So, and then, where am I here? So your sensory here is, I just thought this picture was kind of funny with all the body parts on the brain there, but that part of your brain is your somatosensory cortex that is telling you, you know, where you are in space again, but instead of where your head is moving, obviously your head is there, your eyes are there, that all is part of it. But unlike the vestibular system, it really tells you that tactile reference to the floor. So, you know, where your feet are moving, how you're grounded, making sure you're not going to lose that grounding, that postural stability all the way through your body, keeping yourself in midline and communicating that position to your brain. So it uses all these muscle receptors around your body to communicate that information about head position, body position, feet, and making sure you stay where you're going to stay without falling over. So then all of these systems go back to the great brain and the central nervous system, your brain and your spinal cord coming off there takes all this information and it creates the appropriate motor response, being you want to get off your couch to go get a snack. Well, you have to get up and you have to walk and you have to open the fridge door. You have to look for something. It all is a lot of different movements that you don't really think about that you're doing, that all the small movements have to be broken down, and all of those smaller sensory systems all have to give that feedback constantly into your brain. Okay, move your arm. Okay, now stand up, but don't fall when you're doing it. Now keep going to the fridge. So that all has to work in sync. Otherwise, it won't happen, right? So any disruption in the system, I really like this picture because it has this vestibular complex here, the number 1 going to the cerebellum, and then the cerebral cortex on top, and then your vision here in the front, and all of those leads and pathways going to your cerebellum, which is the large part of your brain that's responsible for your balance. So all that information going to your cerebellum, and then, you know, if any disruption is in this vestibular area, let's say you have a vision issue, anything in your somatosensory, that information is just going to keep getting fired wrong. And then your brain's going to be like, okay, well, my vestibular system isn't working. Now I'm going to rely on my vision and my cerebral cortex. And that can lead to balance disorders too, because it's not really getting all the appropriate information there. So, okay, so, oh, here we go. I have a scrolling problem. Okay, so now you guys are welcome to do this with me and do a little bit of balance activity and see how you do. So this slide, I'm not going to go too into depth into this, but you know, it takes time to learn. You know, these are just helpful hints for you guys to do at home. If you need more help, obviously you can come see me and we'll do all kinds of other things. But you know, we usually start out in therapy as a beginner, intermediate, or advanced at 3 different levels, making sure that you can progress through the 3. And if I'm going to be kind of sticking into 2 and 3 today for the purposes, because we'll be here for a very long time if I go through every single one. But just know, if you want to try these at home and you can't necessarily not hold on to anything, make sure that you have a steady surface. A sink works really, really good because you can put your hand inside the sink. And if you're going to go backwards or forwards, it's not going to move. It's not going to be like a chair where it's going to tip back on you. And it's just going to always be a trusty surface that isn't going to move. So that's a helpful hint for that if you're going to stick around the beginner level. Okay. All right. So let's get going. Tracy's going to be my wonderful camera woman here.
So
And
stop sharing.
Okay, so we're going to stop sharing and then we're going to come back on. So for purposes of this video, I'm just going to do a few exercises you can do with both feet on the floor. And then I'll kind of show you some other stances that you can do the same exercises in case you want to progress to a different level. Sound good? Okay, so what we want to talk about if you're doing any sort of balance exercise at home is your base of support. So if you're feeling a little off that day, you definitely want to widen that base of support. The wider your feet are, the less chance you're going to have that you're going to fall. The narrowest base of support is feet together. And I don't know if you've ever been in a neurologist's office, sometimes they will make patients do this, feet together, and then you record how long you can stay like this, or if you fall. But this will definitely narrow your base of support for you. So whatever you're comfortable with, you want to just stand regular, you want to challenge yourself, that's fine. So, but standing in a regular base, you know, this is normal, right? You can kind of feel how your ground is with the space. And now what I want you to do here is just close your eyes. And then you're just going to kind of feel what your body feels like in the ground when that visual system that we talked about before is taken away. So it feels a little different, right? I mean, I'm sure we don't walk around with our eyes closed, so it feels a little different when you're moving. Okay, so you can open your eyes. So we're going to do a few of these exercises, and we're going to do them with eyes open and eyes closed, and then you can kind of feel how that feels for you. So I'm going to have you open your eyes. And what I want you to do is we're going to start on our head, and I just want you to turn your head back and forth. So now this feels weird, right? You're going back and forth. But now I want you to go forward again, but I want you to, in the clinic, we would have a letter or something you could hold out, but for this video, I just want you to focus on anything in front of you. If you can look at an object, something closer, and I want you to do those head turns. And I want you to only look at that object. Your eyes should not be moving with your head.
Okay.
So it feels a little bit different when your eyes are looking forward, but your head's moving, right? So you're going to do it that way. And now I want you.
I'm sorry.
You have a question?
I got like when I had that the second time when I did the little treatment for the crystals, then she gave me a tongue depressor with a letter on it. She's like, just hold it out.
Yep, that's classic. So you're used to this. Yeah, I'm like challenging me. So you can. Oh, shoot, kind of putting it out. Okay. So then we can also do nods doing this. I'm sure you did this too. So looking at that letter or that object in front of you and nodding up and down. Yep. Okay, so now what I want you to do is you're gonna, instead of looking at an object and keeping it focused, I want you to close your eyes and now do that same thing back and forth with your head. So immediately, right away, when you're standing, right, you feel a little bit off because your eyes are closed. That's taken away. Now, those with an actual vestibular disorder might find this extremely difficult because they don't have the information that they're mostly relying on is taken away. Okay? Doing all right?
Yeah.
Okay.
Bringing my feet together made me realize that, you know.
Yep, so I have my feet regular, but when you have your feet, this narrow base of support, and then you turn your head, you're definitely going to feel that difference where your body just like, wait a minute, where am I going? So that is a good challenge. So, okay, so now we're going to move to our feet. This is another really great vestibular exercise, is just what we call writing. So making sure your body doesn't come forward, backward, right, left, it wants to stay at midline, right? So we're just going to do some ankle sways. So these are easy enough that you can do at home too. So you're going to come up on your toes, back on your heels, and then back around again on your toes in a big circle. Kind of having your body sway back and forth, but now we're giving your feet and your ankles kind of all of the attention here to make sure that your somatosensory system is really making sure that you're grounded and it's feeling the space with the ground. And then you can do some sways back and forth. So back on your heels, back up on your toes, back on your heels again. That's just kind of great. Also a bonus calf workout for this. So, you know, there you go. See? Oh, not that I want to see you fall, but you know.
No, I know.
So now we can really kind of up that ante. Tracy, you can grab that mat there. So at home, if you want to challenge yourself without, you know, single legs or other positions, couch cushions work great because they're a little bit more steady than a pillow. Of course, you can progress to a pillow. That'll just give you a little bit more wobbly balance. But you can take a couch cushion and now come up on that. And then do those ankle sways around. Same thing we were doing before.
I'm curious.
Okay.
Ooh.
I'll let you try that quick before I
Okay.
see how that's a little bit different.
Yeah.
So even just standing normal on it, get your balance first,
Right.
and then now close your eyes on that surface. So it might be just challenge enough just to close your eyes and stand on a surface there for your balance.
Yep.
So that's always a great progression, is to be on what we call a non-compliant surface. So a surface that's gonna move. Okay, so now to get our arms involved, one last vestibular exercise I wanted to kind of highlight is moving your arms and your body all at once. So this is progressing yourself to a different level. So any object you have in front of you, don't really care what it is. I'm just using a ball. You can grab a can, you can grab, your water bottle. And I just want you to hold it out in front of you. And you're just gonna look at it. And I want you to not lose track of that object. And what your body is gonna do is similar to what your ankles did. So you're gonna hinge at your waist, come forward, and come back up in a large circle. Your legs really aren't going to move, but you're going to be staring at that object. Let's do, a few on each side. So this is giving, information about your body's moving, but now it's moving at an accelerated rate, and your eyes have to stay focused at the same time. So you can switch directions. So a lot of information is happening here, a little bit more advanced if you can't. And then to progress it, you can even come all the way down to the floor and back up. And that's gonna really give you some input to keep yourself balanced. Now to progress that onto I won't do it for purposes of today, but you can also progress onto your unsteady surface here and do your circle sways, and that's gonna just give you a little bit more input. So to end it, so that was just all stuff that you can certainly do, showing you that you don't have to do these crazy yoga moves. You can still just stand here and get some vestibular work in without being too crazy. You can, of course, do those, narrow base of support, like we talked about. You can do what we call a tandem stance, which you might have had to do at a doctor's office too, is one foot in front of the other, like this. And now do those head nods and back and forth. You can even, walk like that and turn your head back and forth. Now we're progressing to walking. So that's even more on the, advanced level 3. So, and then you can also do single leg. So single leg up and now do your nods and now go back and forth. The ball in this one is obviously very hard. I don't know if I can even do this, but you can certainly try to go around and do a single leg stance, even a single leg stance with your eyes open and eyes closed. Okay, so just to highlight a few things you guys can do in the time we have. Hopefully you learned a little something new or some helpful hints. So now I'm going to come back on. I just have a little bit more presentation here. There we go. Coming back. There. Okay. So that was some, highlighting some vestibular things. All of those I do in clinic here with my patients, but then, we have a lot more ways we can progress them and do that. Okay. So now that we've done that, what else can you do at home to help you stay balanced? How can you decrease your risk of falls? How can you environmentally help yourself? So modifications to live a more balanced life. So what is definitely controlling the controllable? Can I see this?
No.
Okay. So what I have here is a question is, what do you think the #1 room in your house is that is you're most likely to fall in? Which one do you think?
Wouldn't that be bathroom?
Bing! You're good. A lot of people want to say kitchen, which is also true because you're moving a lot in the kitchen. But bathroom, definitely number one. You know, you're more likely to be wet, dry, and, you know, not have shoes on. You're going to be reaching for a lot of things. Sometimes you're going to be in a hurry because you're getting ready. And now you're just have all these other factors going on. So the bathroom is definitely the number one place to fall. So, you know, I know falling is usually like old people fall, right? And that is definitely true. Old people fall, but anybody can fall. You know, if you're living with a dizziness disorder and you have increased muscle weakness because you live a sedentary life, you're also at risk for falling. So, how to take back your balance at home. Things you can do at home, declutter. I mean, obviously, you know, these might be a little obvious, you know, for you, but sometimes there's things that you leave in a certain spot that you don't even think about that maybe it shouldn't be there. My house is particularly bad for this because I have 4 kids. So there's always hazards for me to be falling on the floor, but the best you can, just at least move the things out of the way in your walking spaces. Area rugs. Area rugs are big, especially if they're not anchored to the floor with the sticky, you know, double-sided tape. Always have a non-skid surface underneath your area rug if you're going to have an area rug. Otherwise, if you have a rug that's just moving, just get rid of it if you don't need it. So area rugs are a big one. Adequate lighting, making sure you can see. Now this one gets a little tricky with you guys too, with your migraines, because you're like, well, I don't really want to, I'd rather be in the dark, but now I can't see where I'm walking. So it's really just finding the type of light that's good for you guys. So obviously nothing fluorescent. There's all kinds of different light bulbs that you can change. They even have light bulbs now that you can screw in and like work from your phone, an app on your phone to change the lighting on them and what kind of light you see. I have one of these in my bathroom. It kind of works, kind of doesn't work, but it's still kind of fun. So that's definitely a thing for someone to play around with. Arranging furniture. So this goes back to maybe you have a chair somewhere that you're always kind of getting your toe on, you're always stubbing it or somewhere, and maybe it's just not in the right spot and it could be just a fall hazard. So not in front of main walkways, not in front of doors. And then this installing the non-skid surface I went over. So that's all stuff in home. Lifestyle changes, obviously. See your doctor regularly. Make sure you're doing okay there. Wearing appropriate supportive footwear, especially true in summer when we all want to wear our flip-flops and, you know, go around. But sometimes it's better if you do have a balance disorder to wear something a little bit more supportive that's going to give you better feedback. Taking good care of your feet too, your nails and your skin is actually huge for balance. So if you're taking care of your feet, you're cutting your nails, you're not letting them get crazy. You know, we see this sometimes in the hospital where I used to work, where it was like, oh, no wonder you can't stand up. So this is very important to give your sensory system the amount of feedback it wants by just taking care of yourself. And obviously getting regular exercise, being healthy in general. So yeah, so those are all grateful hints. You know, sometimes it can be overwhelming if you're like, okay, there's so many things I gotta look at and change. I'm just gonna give up. So just work on small achievable goals, just like exercising, little bits at a time. And in the end, hopefully it'll make a positive change for you. So that's where I come in. If you need me, I'm always here. Don't be afraid to reach out with questions or come in if you feel like, oh gosh, I really need to, you know, make some changes, feel free to hit me up or ask Dr. B for a referral, and I'm always here. And I can't scroll again. Okay. All right. Scrolling problems. Okay. Any other questions for me? No? We're doing good?
That was good. That was very,
Okay.
yeah, it was good to go over that, like that cushion, like upping
Good.
that'll be great. Thank you.
Good. I know, like, my first one was a little stuffy, like a lot of talking. And I wanted to just have a little bit more fun this time with it and kind of do a little bit more on your feet. So yeah, I had fun doing this and putting it together.
Very
Thanks so
helpful.
much.
Thank you, guys. All right. Have a good afternoon.
You
Tracy.
too. Thank you.
Thank
Thank you
you.
for coming.